Can the hospital insist that an ophthalmologist should be available for consultation and perform surgeries during this pandemic? To answer this question, the most important factor would be the relationship between the ophthalmologist and the hospital. I am talking about the legal relationship. If the relationship is casual, that of a visiting consultant, then obviously the liability to be available for surgeries or consultations would be very low, in fact non-existent. But for the ones who are on the payroll of the hospital, take salary, are in regular employment, there is a greater responsibility to be available for consultations as well as for surgeries. There is another important factor that will also have to be taken into account: the type of duty that a doctor is being asked to perform. In these times, saying no for a regular consultations, the usual consultations, should not pose any legal problems for the doctor. One can choose not to be available for such consultation. Scheduled elective surgeries can certainly be postponed. Saying no, even here, may not pose any legal problems. But refusing to perform even an elective surgery, where the consequences of not performing the same could be grievous for the patient, would certainly fall in a different category. Delay in performing that surgery, if that could result in loss of life or limb, loss of vision or loss of eyes, it's a different ballgame altogether. In a court, the defense of force majeure or will of God will certainly be invoked in favor of the doctor. But what protection this doctrine will afford to the doctor will depend on a number of other factors. It is very risky to say no. Next, refusing to attend a patient who needs an emergency surgery will be the toughest to defend legally in a court of law. States in India, some of them, have invoked a law known as Essential Services Maintenance Act. After invoking this act, the government will be able to enforce attendance of doctors by bringing them under the essential services. Refusing to perform a surgery or give consultations in the absence of appropriate personal protective equipment is certainly justified. Thank you.